Hi, I'm Cassandra Kasten-Arias, a third-year medical student at OHSU, and I'll be presenting on healthcare utilization for asthma exacerbation among migrant and seasonal farm worker children. Asthma is a common pediatric disease with high rates of avoidable acute exacerbations. 1 in 6 children with asthma will visit the emergency department, and 1 in 20 will be hospitalized every year. These numbers are even higher for Latino children. Our study focuses on Latino, migrant, and seasonal farm worker children who are known to be at high risk for poor asthma outcomes due to various medical access barriers and poor housing conditions with known asthma triggers. It is unknown how these children interact with the healthcare system when they have an asthma exacerbation and whether there are disparities in their care. So this leads to our study question. Are Latino migrant seasonal farm worker children more likely to have higher rates of ED visits, acute clinic visits, and hospitalizations for asthma compared to non-Hispanic white children and Latino children without migrant status? With our hypothesis being yes. To answer this question, we conducted a retrospective cohort study utilizing electronic health record data from a network of community health centers across the United States. We compared 3 different ethnic and migrant status groups of children with asthma: non-Hispanic white children, Latino migrant status, and Latino non-migrant status. We then evaluated the annual rate and whether patients had ever had an acute clinic visit, emergency department visit, and hospitalization for asthma exacerbation. We calculated odds and rate ratios for these events and adjusted for age, sex, insurance, federal poverty level, number of residential changes, and primary care clinic visits per year. Looking at the top graph, we found that Latino children, regardless of migrant status, were more likely to have ever had an acute clinic visit for asthma exacerbation compared to non-Hispanic white children. There were no significant differences in odds of ever having an ED visit or hospitalization for asthma exacerbation for Latino children regardless of migrant status compared to non-Hispanic white children. Now looking at the bottom graph, Latino children with migrant status had a lower rate of ED visits and hospitalizations compared to non-Hispanic white children. There were no significant differences in rates of acute clinic visits for Latino children regardless of migrant status. So overall, Latino children who had a migrant seasonal farm worker designation in their clinic compared to non-Hispanic white children were less likely to have ever gone to the ED or been hospitalized for asthma exacerbations. They also had lower annual rates of visiting the ED and being hospitalized, and had higher annual rates of acute clinic visits. These findings do not support our hypothesis. Instead, they show that community health centers, or CHCs, may mitigate previously reported disparities in ED utilization and hospitalization. These CHCs appear to serve as safety nets for this population, perhaps better managing their asthma as to prevent severe enough exacerbations that require hospitalization or an ED visit. Additionally, migrant seasonal farm worker parents may more often choose to come to the clinic instead of an ED when their child is having an acute exacerbation. The reason for this choice likely involves multiple factors, such as trust, where CHCs provide culturally sensitive care in a patient's preferred language with an established provider; reduced cost, where CHCs provide sliding fee scales; the political climate of the region toward migrants; and the proximity to the clinic versus the hospital. Lower acculturation and health literacy may similarly impact this outcome, with studies showing that these factors correlate to lower patient empowerment, greater trust in their provider, and higher medication adherence. Further research is needed to determine whether these lower disparities are unique to culturally sensitive CHCs compared to other clinic settings.